Hello GutSquad, welcome back to my channel. This is Cecily as always. Today is going to be a little bit of a review of my medical history. The reason I'm doing this is because I feel like I haven't gone through like a really accurate timeline of how my surgical and medical history has progressed to the point where I got like 5 stomas. I sort of mentioned it in my first video on my channel, but I really wanted to just sit down and maybe give you guys the full scoop of what I've been going through since I was in my teen years. So let's get started. I started out as a baby, as everyone does, and I really did not do well with breast milk or most formulas that my mother tried. I was constantly throwing up, constantly having colicky symptoms, and just constantly unable to take food and really benefit from it. I was just throwing up all the time. I barely got 2 hours of sleep as a child, uninterrupted by some sort of problem in my early years up until I was about a toddler. I remember at the age of 8 thinking that everyone had pain after they ate. I just thought that it was a universal truth that eating hurt you. Because I'd experienced that my whole life, I didn't know anything different. And it wasn't until I started talking to doctors and my parents more about it and being really upfront, because it got so severe when I was around 12, that everyone was like, that's not normal. You should not be feeling this way from having a sandwich. We discovered that there was something wrong then. I was put on multiple laxatives. I was put on things like Miralax, and they gave me vitamins to supplement, and my diet changed a lot in my early teens. And you know, I had to go off a lot of the things that I used to love, but I did feel better. And the laxatives were kind of doing their job. I got through it. But really things came to a breaking point when I was 19. And that's when my colon ruptured. Now my colon ruptured for idiopathic reasons. They can't really tell me why the colon ruptured the way it did in so many different places. It ruptured in 3 different places: the ascending, transverse, and descending portions of the colon, which for those of you who aren't familiar with anatomy, that's pretty much the entire colon fell apart. And the only thing they could really pin it on, since there wasn't any inflammatory markers in the blood or inflammation present in the bowel tissue, was something called pneumatosis. Pneumatosis is kind of rare, and it's atypical for it to be so severe that it causes an entire portion of the bowel to just disintegrate, basically, but that's what happened to me. It was a tough road after my colon ruptured. I had a very small portion of my colon left over called the sigmoid colon. That portion of the colon is the one that's directly attached to your rectum and anus. So I had what's called an anastomosis from my small intestine, the ileum, the last portion of the small intestine, to the last portion of the large intestine, the sigmoid. And they were joined, and I was able to defecate normally without any kind of bag. However, my defecation did not turn out to be normal in the end. As I mentioned in my living with incontinence video, I unfortunately had really severe anorectal dyssynergia, which means that your anus and rectum, which are 2 distinct muscles, basically don't work together. They have a really difficult time working in conjunction to help you control your stool output. So I had almost no control over my ability to defecate. I would have periods of time where I was extremely constipated and straining. I had hemorrhoids for years. I also had really severe incontinence, and I would just go to the bathroom whenever, wherever, and I had to wear diapers and sleep on bed pads. It was a really difficult 2 years for me, and it was when I was first starting college. So in addition to all my freshman troubles, I also had this really severe incontinence that was making my life just that much harder. After about 2 years with the anastomosis and no bag, I finally came to a breaking point in spring of my sophomore year of college. When I was in an organic chemistry lab, suddenly I felt some of the most intense pain I've ever felt in my entire life. The whole day before that had been pretty bad. I'd been very nauseated, and I'd been having a lot of cramping, but I didn't know what was causing it. And I certainly wasn't gonna miss my orgo lab just because it was a tough day. My fellow ostomates and GutSquad out there who are dealing with chronic bowel disorders probably know that if you wait to feel good to do anything, you're not gonna get much done. So sometimes you just need to bite the bullet. And that day was one of those days for me. So I went to this lab. I kind of wish I hadn't because that was the day I got one of my first like volvuli incidents that was really severe and bad enough for me to need hospitalization urgently. I was in the middle of this lab, started screaming. My lab partner was like, are you okay? And I just rushed out into the middle of the hallway outside of my lab room, held my knees to my chest, and I was just like wrenching in pain and screaming into my lab coat. My teaching assistant for the lab came out and he was like, it's okay. His name was Andrew. He was so sweet, and he was a paramedic on the side. And he said, I'm a paramedic. We're gonna get this fixed. So he called 911. He called my mother, and they had the paramedics come and pick me up from the hallway. Unfortunately, the paramedics were unable to place an IV without some contamination of the needle. I was writhing around a lot. I was in a lot of pain. They kept missing the vein, and I was bleeding all over the place. I had to throw out my lab coat because it was covered in blood. They unfortunately did not place the IV very well, and I got a staph infection that was really serious and went up my entire arm. It was a mess. So they could not operate on the volvulus, which is what they would normally do in this situation, because volvuli very rarely are left without surgery. But they were unable to operate because of that staph infection, so I had to just be off liquids and food for about 2 weeks. It was really tough, and the surgeon there said, well, I would operate on you, but I can't, so I want you to go and see a surgeon when this resolves so you can get an ostomy. You need to get rid of that portion of the sigmoid. That portion of the sigmoid is the one that's ovulating the most. I went to a surgeon and she was amazing. She gave me my first ostomy. That was in June of 2018. The first ostomy went very badly. The first ostomy ended up becoming necrotic due to ischemia. Ischemia is when you basically cut off circulation to a portion of your body and it swells up with fluid and things, and the necrosis was caused by the lack of blood flow. So I was on the brink of death with this stoma, and it took the doctors a while to actually figure it out. It took them a while to figure out like what was wrong, and they eventually just said, oh, we need to go back in now. So I was in ICU for a few days, and they took me back into the OR, the operating room, and they gave me a new stoma. That new stoma worked very well for a few months, but then in August, September of 2018, I started to have my prolapses. Prolapse is when a portion of the bowel basically falls out of where it's supposed to be. My prolapse was about at the end, like 18 inches. It was very long, and it was hugely swollen, and the doctors had never really seen anything like it. My surgeon that had operated on me twice was like, I'm sorry, I can't help you. This is really serious, and you need to go to a specialist in ostomy revision surgeries and laparoscopy. So that's what we did. I took off from school for a really long time to heal from that, and I went out to the Mayo Clinic in Rochester, Minnesota, and they had just the best surgeons in the country look at the case, and one of them said, I'll take it. And he took my case, and I couldn't have been more thrilled. I was so relieved to hear that someone was going to take my case. There are very few things as scary as a doctor telling you that your problem is out of their scope, because I think we're conditioned as people who go through Western medicine all the time to think that our doctors will always have answers, and often they don't. And often they feel like it's more risk to fix something, and maybe that someone else is more qualified. And I'm actually very happy that my surgeon said that, because if she didn't feel comfortable doing the surgery, I didn't want her doing it. So we went out to the Mayo Clinic for my surgery in April of 2019. It was right around my birthday, actually, which is coming up this week. That's why this video is so much in my mind, because it's about a year anniversary from one of my most invasive surgeries. So I had my first stoma revision. It went well. Then I had some problems. I went home after the hospital recovery and I ate some solid foods, and suddenly I was screaming on the floor about 2 hours later. My mother was staying with me out in Minnesota, and she called the police, she called 911, she called the EMTs, and she was like, oh, we need to take her back to the hospital. Something's wrong. Something went horribly wrong with this stoma. And she was right. The stoma had become entangled and blocked at the very tip end of where the opening to the abdominal cavity is. We don't really know why that happened. The stoma just basically failed. So we had to go in for another stoma operation, and then that one worked. At least for a while. So the Mayo surgeon fixed up my stoma. I was at Mayo for another month and a half or so. I was in the hospital for just weeks and weeks. And it was very similar to my first set of stoma operations, and then I had to be on TPN. I was losing weight. There was no way to get me back to eating foods. I would just vomit all the time. After that second Mayo stoma, the revised Mayo stoma, in April of 2019, I got an ileus. And for those of you who don't know what an ileus is one of my least favorite things of all time. An ileus is when all or a portion of your bowel slows to a halt and basically becomes paralyzed. You can have food stuck in there. That's why it's better for me to avoid foods with high fiber content, because high fiber content foods typically get stuck in the bowel if it's very sluggish. Once the ileus resolved and I was able to tolerate some food, I was released from that hospital and I was able to go home. I went home, started my studies anew in the fall of 2019, and I was so excited because I had been away from school. I just wanted to get back on the horse so badly. So I only signed up for like 3 classes. I was taking it really easy. I was trying to do less extracurricular activities. I was trying to manage my symptoms at home because I was still having nausea, vomiting, and eventually that stoma from the Mayo Clinic, the second one, failed. It prolapsed slightly, not as much as my first prolapse, thank God, but it was pretty bad. We had to go, to the doctors. They kept saying, well, there's nothing really we can do for it. It's a small prolapse. Just try to wait it out. It might resolve on its own. That didn't happen. In October of 2019, I had my final ostomy surgery to this day. The thing that precipitated that was yet another volvulus. I was in the middle of a midterm for one of my political science classes. I started sweating profusely, having that horrible pain that I had back in my chemistry lab all those months ago, years ago, and I knew exactly what it was. So I got out of my exam, which I ended up getting like a perfect score on. I don't even know how, because I don't remember like any of that exam. I just remember being in horrific pain the entire time. So I came home and I laid on my bed and I was like, I can't move. I can't move. I can't talk. I can't, my boyfriend called me, my mom called me, everyone's like, how'd the midterm go? And I'm like, get off the phone, I'm dying. I called the ambulance, they came and got me, and I remember my boyfriend came and saw me in the hospital while they were trying to figure out what was wrong with me. It was the first night that I knew that he was a good guy, because he just stayed with me the entire night until my mom could drive up from where she lives and be with me herself. He took care of my cats while I was in the operating room. It was amazing. The next 2 weeks were tough. Anytime you go under that kind of anesthesia, it will mess with your bowels. So I had like about 2 weeks in the hospital of just being off food and recovering very slowly. We had a few issues with the wound healing from the old ostomy takedown site, and I got a new site for my stoma. And that's the site that I have to this day. As of right now, I have this 5th stoma. It's been working really well. It's had a few tough days of being either lax or retracted and, a few other issues like that. But for the most part, this is the most successful stoma I've ever had, and I couldn't be more grateful for that. And I know when I tell people like, oh yeah, this is my 5th stoma, that sounds excessive, and it is. Most people maybe have 1 or 2 revisions ever over their entire life of having a stoma. Mine just weren't sticking for a good 2 years. Just went up and down with all of these different stomas that all failed for different reasons. The point of my story is to show you all the power of resilience. There were days that I wanted to give up. There were days that I wanted to say, you know what, F it, I'll live with the prolapse. F it, I don't want to go back into the hospital. But you can't think that way, because you don't know when you're gonna need to just put your health first and put your comfort dead last. That has been my reality for the past 2 years. I'm excited because the stoma's been going well, although I have had the blockages and sepsis and another blockage this past week. I'm still so much better than I was when I was having those diseased stomas that kept getting blocked and tangled and prolapsing. Sometimes, even when you've had a tough week, the best thing to do for your mental health is to think about how much worse it could be. I know that sounds kind of morbid, but thinking about that over this past week with the blockage, just being like, I don't need surgery. This is just a small pseudo-obstruction that doesn't really need to be operated on. I was so thankful for that. So my story, I hope, can inspire you all that if you're young and you have an ostomy, or you have a chronic bowel problem, or if you have any kind of chronic medical issue, you're not alone. There are a lot of us out there. We can never feel like we're totally in control of our lives. Having your health taken from you is one of the most paralyzing things for a person. Although I've lost a lot along the way, having all these surgeries, I've lost friends, I've lost time in school, I've lost time putting my life forward, you know. You can't think about it that way, because I would not be here where I am now if I hadn't put my health first in all of those situations. Taken off of school, taken time away, taken time to rest, recover, heal, go to tons and tons of hundreds of doctor's appointments to try to diagnose, try to fix the problem, get new medications, try them, leave them if they're not working. This is a very difficult road, and I think people tend to expect a linear upward slope for their healing. I know I did for a really long time, especially after my colon ruptured. I thought, well, the colon's out, so the problem's fixed, right? No. And I might be thinking today, oh, well, my stoma's working, so the problem's fixed, and maybe something down the road will happen that's totally unforeseen. Who knows? But what I can say is that you should not expect your healing, your recovery journey to be a linear upward slope all the time, because it just won't be. It's gonna be more like a roller coaster where you go up and down and up and down and up and down, and there's like these really crazy free falls that you just feel, I am terrified right now and I don't really know who to ask for help. And you're gonna have times when you're on the upswing and you want to push yourself to like make up for that time that you didn't have. And I'm struggling with that myself right now. Of, okay, I'm feeling better, so now I want to do everything I didn't do over the past 2 years. And that's just not how it works. It would be silly for me to overload at college. It would be silly for me to take on everything all at once and bite off more than I can chew. I've done that before and it did not go well. You have to work at the pace that your body sets for you. I'm saying this as advice for you and for myself. I want to look back on this video in 3 months and be like, yeah, Sess of the past was right. You can't push yourself past where you're meant to be. The question is, where are you meant to be? And I think for me, where I'm meant to be is exactly where I am. Recovering, being careful, honoring my weight limits for lifting and my food restrictions. What you can do for yourself is to think about all the things that you still have in your life. Don't dwell on the things that you've lost. That's it for me. I hope you guys enjoyed this video. Please let me know what you think down below. I would love to hear all of your surgical histories as well. It gives me a lot of inspiration to read what you guys have to say. I always appreciate it a lot. As always, I will see you in my next video. Bye, guys!